So who's like the coolest people that you've interviewed? Were there any like
Um,
weirdos?
Actually, they're all really interesting. Like all the people were really interesting.
That's
We had
cool.
a couple of talks about breast cancer because it's Breast Cancer Awareness Month.
Mm-hmm.
So, or it was Breast Cancer Awareness Month. So in October, we did have a couple of breast cancer uh people like patients who were also doctors, and they talked about their experience and stuff, and that was really interesting.
Yeah, that must be crazy.
Yeah, it was like personal stories and stuff, which was really nice.
Yeah, that's super cool. I don't
Yeah.
have any breast cancer stuff, but
Yeah, we're trying to.
hopefully you guys will get a better opinion or I don't know. You'll know more of what a chiropractor does.
Yeah, I'm actually really interested in it. So like,
That's awesome.
as a DO, oh sorry, wait, what?
There's a lot of bad chiropractors.
Oh
Um,
really?
yeah, like the old school guys kind of follow like this like Bible type thing of how it was
Oh,
created, and like
mhm.
yeah, I'm like in my own world kind of, but it's cool. I don't know,
Yeah.
it's cool.
Yeah, no, and like I'm in the DO program at MSU, and we learn like OMM stuff. So like
Mm-hmm.
osteopathic manipulative medicine. It's kind of like that, but like that's why it's like really interesting to me. Like I really want to like learn a lot from this talk. So
Yeah, yeah, that's super cool. Anytime you have a question too, just let me
yes,
know.
for sure. I
Not
will.
Jose Dio.
Yeah. Oh, really? That's
Mhm.
awesome.
Yeah, he doesn't do a lot of like manipulation.
Hmm.
He owns like urgent care clinics.
Oh, okay. That's
So
really cool.
yeah, he's um he's kind of badass.
Yeah,
He's a cool guy.
that's really cool. So like medicine kind of runs in the family then.
Yeah, kind of. You know, my Asian side grandparents, they really pushed going into the medical field. Um,
Yeah.
but you know, I never really liked the like medicine in itself,
Mhm.
not medicine. You know, I like to use my hands and like, you know, put
Right.
things together, you know.
Right. I think
So
that's
I
really
went a
cool.
different route.
You
Yeah.
like found like a happy medium.
Yeah, exactly, exactly. And my grandpa like hates chiropractor. So when he
Really?
found out that I was going to chiro school, oh my, he like basically disowned me.
Oh
Yeah,
my God.
yeah, it was it was pretty bad. And I was just like, well, sorry, man. This is what I want to do.
That's funny. Yeah.
Yeah, my mom's in nursing, and then my mom's sister's in dermatology.
Oh wow. That's
Mhm.
awesome.
Mhm.
Okay, so yeah, there are a lot of like medicine related.
Yeah, yeah.
Yeah.
And then my dad's side's like they're all like engineering,
Hmm.
the
Yeah.
freaking nerds.
No, yeah, that's how it is for like my family. Like my parents are both engineers, but somehow I found medicine interesting.
Yeah.
Like my sister and I were like, we're not.
Are you good at physics?
I'd say I'm pretty good at physics.
Like it's easy.
I don't particularly love it, but I didn't find it that difficult.
Okay, yeah. You could probably be an engineer.
Yeah. Yeah. I was just like, I could never sit at a desk in front of a laptop all day. Like I would.
Oh no. Actually, some of my friends, they're like mechanical engineers. I guess it doesn't really matter, but they're on the sales side. So
Oh, that's
yeah,
interesting.
they're like going to businesses and like selling the product kind of and
Mhm.
like teaching them how it works and how it would be better and be more efficient for them to buy it.
Mhm.
So and they make a lot of money and they like it. It's cool.
I
So
know like engineers are starting to make a lot more money now. Like
oh
it's starting.
really? Nice.
Yeah. One of my cousin works in California, and he was just saying, he was like, we were just talking about it, and he was saying like engineers, like their salaries are like climbing now. So
I'm sure. Yeah. I mean, they're in HVAC. They do like AC air
mhm.
conditioning. So I mean, like you know, there's gonna be more people inside, I guess now.
Right. Yeah, that's true.
Probably gonna help a little bit.
Yeah, that's true. Yeah. Oh yeah, we're live now.
Oh shit! Wait, do I? What do I do?
No, no. We're just waiting for a couple more people to join, and
Okay.
then I'll just like introduce you, and then we can begin.
All right. Sounds good. So how does this work on like Insta or YouTube?
So basically what happens is once you start the YouTube live, like it just goes live on YouTube and then it like records it. So then anyone who wants to watch it later can come back or like look at the YouTube channel and see all the videos or the past live sessions that we've done, and then they can view it and watch it as many times as they want.
Do they join on YouTube?
Yeah, so you just like go to the MyMedicalMessage account and then you see the live stream and it'll say live in the corner so you know which one's live. And when you click on it, you can like see it live happening and they can like type in the chat. Someone said hello. But yeah, so they can like type and we'll get it live questions and stuff.
Cool.
Yeah.
Whew. Did you guys have a long day?
Yes. I've literally just been studying all day.
Oh my God, I do not miss that.
No. But isn't it like in medicine, like you're just always constantly studying? It's like
Oh
just
yeah.
so I guess I gotta get used to it. I'm not even in med school yet, so I got a long road ahead of me.
Yeah, I don't know. I feel like undergrad, it's more you more learn how to like manage your time. You learn how like your study routine, like what is good for you, like study wise. Like, is it like taking a bunch of notes or is it like recording the lectures? Like you figure that stuff out, and like how to manage time, how to study all day, how to like get proper sleep, I guess. If you're like that, that's how I was. And then when you get into like the grad school stuff, it's like you're kind of already prepared. It's a lot more, but like you're already kind of like, yeah, I'm already here, so like
Right.
I'm gonna struggle, but it's okay because everyone else is struggling too. You
That's
know?
I mean, yeah, like that is true. I guess undergrad is like prep for med school.
Yeah, and you're like not technically there yet when you're an undergrad, so it's
That's
a
true.
little bit more pressure and stuff.
Yeah. No, yeah, you're probably right. Like, I know like med school, what I've heard is just med school is like undergrad on steroids. So
Yeah, probably, honestly. Probably a little harder, honestly. I don't know.
yeah. Okay, we can like go ahead and start. So hello everybody, welcome to our shadowing session today. This is Dr. Tyler Bigenho, and he is a chiropractor. So before he begins, I just want to say make sure to type in all your questions into the chat, and we will be sending them to Dr. Tyler Bigenho, and he will be answering them towards the end of his session. And we will be posting the Google Forms at the end, so make sure to stay tuned for that. But yeah, you can go ahead and begin.
All right. How we doing? Okay, share screen, presentation. There we go. Okay, so yeah, this is me, Dr. Tyler. DC stands for Doctor of Chiropractic. It's not med school. It is a separate program. Basically, you go to undergrad first, and then you apply for this program. There isn't like an entry exam, but it's pretty rigorous. It's like 10 trimesters of 15 weeks each, and there was some trimesters where we had like 32 units. So it's pretty science heavy, but it's cool. It's cool. I own my own practice. It's called Clean Spine Chiropractic, and I'm in Newport Beach, California. I've been in California my whole life. I went to undergrad. Oh, I'll get to that stuff. That stuff's boring right now. So first off, what is it like? Oh, this is my boy too. Can you guys see my mouse? Can they see my mouse? Okay, cool. This is my boy. So um, I don't know if anyone's seen any of my videos, but I like to do a lot of education on kind of like how I do an adjustment or like what I'm looking for, what I'm looking at. So I use the spine a lot. And you know, one of my patients once, so I've always had him, his name's Ralph. And ever since school I've had him, and his name's Ralph. And you know, one of my patients was like, dude, you should totally like characterize that guy, like make him like your sidekick, you know? So like this dude's my sidekick. He's my boy. I love him. Yeah. Take care of your spine. It'll like you when you want to play with your grandchildren. It'll like you a lot. So what is it like to be a medical professional in my field? So like I said, I own my own business. I'm just the type that I can't have a boss. I'm sure probably a lot of you guys are as well. My hours vary. I'm usually about 25 to 30 hours a week. But I put asterisks next to there because I am constantly working. I'm working all the time. That's just in the office. You know, I'm a one-man show. I have two people working for me in my office. I have a massage therapist and a physical therapist. They rent out rooms in my office, but I'm the receptionist. I do all the insurance. I do all the scheduling, the billing, the coding. I do all of my marketing. I'm on TikTok, Instagram, and I'm just starting YouTube. I'm actually paying someone to do YouTube right now, but yeah, it's a lot, you know, and I do personalized follow-ups to every single patient. So like 2 or 3 days after their appointment, whether they want a text or an email or a phone call, I send them a message and I say, hey, how you doing? How we doing? And, you know, that takes a lot of time too. Not a lot of people want to do that, but, you know, patients love it. So keep that in mind. Patients love that. So some of the stuff that I usually see, it's pretty general, just headaches, disc herniations, sciatica. A lot of people post-surgery who still have pain, who are like, hey man, like I had surgery and it didn't help. Like, what do I do? Obviously posture pain, you know, people are sitting down a lot. Injuries, scoliosis, what have you. Basically, I see the same thing every day. It's like, yeah, I sit at my desk for 8 hours a day. Why does my neck hurt? Or like, yeah, I deadlifted like 400 pounds and my back popped and it hurts now. Can you help me? You know, it's like stuff like that. But a lot of people, they'll come, they get an MRI or something from their doctor and they got recommended surgery and they use me as their last resort. They're like, hey man, I don't want surgery. I don't want to do it. So fix me. So yeah, that stuff's pretty cool because it's always a challenge, you know, every single person's different. And you really have to like delve into like what's really going on, you know, what are they doing outside of what they're saying, you know, like what do they do all day? Do they eat healthy? Do they lift boxes and stuff? I don't know. Are they cool? Are they stressed out? What keeps me most interested is I love to just educate my patients. So like my goal is to bring people in and educate them so that they don't have to come back. So like you can avoid going to a chiropractor. Obviously, like I'm biased. I love getting adjusted, but you can totally avoid going to a chiropractor if you do certain things every day, you know, but some people just don't want to do that every day. So it's totally fine. Like that's why you just go to a chiropractor, get cleared up and you're good, you know, or go to a physical therapist and do some rehab exercises and you're fine. But yeah, that's what we're here for. Let me see. So I'm going to do a couple interesting cases that I've seen a couple times. So I did some like general like lingo stuff. Like so 45 YOF is year-old female. So 45-year-old female complains of general neck and low back pain, right? Like she's just like, hey man, my neck hurts, my back hurts, fix me. And she's like, pain is always there. And I asked her about, you know, has she been to her general practitioner in a while? Have you gotten any blood work? She's like, no, I haven't gone in a few years. She was one of those girls that was like, I don't like going to the doctor. They don't know what they're doing, blah, 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 you know? So, you know, it seems like a normal case, you know, just little neck pain, little back pain, but she has night sweats every night. And that's not normal. Night sweats is not normal. You know, it can be hormone related. Sometimes it happens, but it's not normal. Like you gotta dive in a little bit deeper. She has mid back pain that wakes her up at night frequently. So let me just say, when you go to sleep, your normal bodily functions are supposed to shut down. So if you're sleeping and you wake up from pain, like something like you have pain in your mid back that throbs you and wakes you up, that's not normal. Like that area should be shut off. That means something that is supposed to shut off is not shutting off, which is not good. That's a big red flag. That's like, hey man, you should get some imaging. You should get some blood work. That's serious. She also has a lot of migraines, lives off of over-the-counter medication like Excedrin. Not good. So what do we think? What do you guys think? Is this like, doesn't this excite you? Like it seems like she comes in with neck and low back pain. And if I didn't ask the questions, like, hey, do you have night sweats? Do you have any pain that wakes you up at night? If I didn't ask that, I would never know. I would never know. No one would ever know. So how do I like, is there like a chat thing? I forget. Oh, there is a chat. Oh.
These are just questions that they've been asking, but you can answer those at the end. If you do want to ask like live questions, I'm sure they will answer them in the live.
Okay. Well, maybe not this one, but yeah. So on the next one, I'll ask like some questions. But so what I'm trying to get at is it looks like a normal case. And if I didn't ask the right questions, it would be a normal case, right? So next one, patient believes this is normal and fine. Told her to go to her GP, boom, stage 2 pancreatic tumor. They basically had to operate right away and she went into chemo. And I don't want to say I saved her life, but like, you know, if I adjusted that girl, my license would be jeopardized 100%. Because I mean, you know, it doesn't mean you're going to make the cancer worse, but you know, you never want to be the practitioner who touches a patient last before she dies from cancer. You know what I mean? So it's really important. Like I thrived in the diagnostic portion of my my schooling. So I can diagnose someone 95% of the time just by asking them questions. And like a lot you'll notice a lot of really good clinicians that you guys will come across can do the same thing. It's not a talent. I worked my ass off to be able to figure out stuff like that. But you know, as a chiropractor, like people see this stuff all the time, you know, like oncologists, you know, general practitioners. As a chiropractor, like they just come in and they're like, dude, my neck hurts, you know? And it's up to you to ask questions and just not get in a super boring rhythm of just like, oh, his neck hurts. Okay, let me just crack his neck, you know? Because what if that person has cancer and is causing the neck pain? So I don't know. That's just one of the lessons I wanted to teach. I thought that was cool. Okay, so here's another one. This one is so exciting. So I saw someone on the chat put on sciatica. So 48-year-old female patient, she has sciatica. So what sciatica is, I'm just gonna go briefly here. So we got a bunch of these little nerves that come out of your low back in here. And all these nerves right here, they combine to form a big nerve called the sciatic nerve. And that sciatic nerve goes all the way down your leg like that. So if you have a disc that hits the nerve, it pisses the nerve off. And that nerve will shoot pain all the way down your leg. That's sciatica in a nutshell. So something is causing this nerve to be pissed off and it's causing pain going down your leg. That's all you gotta know. So she had surgery. They're like, oh, you have sciatica? Let's do an MRI. And MRI is really good at showing the discs and the nerves. So, or the nerve roots. Basically, they showed that she has an L5, S1, disc bulge, and degeneration. Degeneration is basically just like it's starting to like kind of rot away. It's like arthritis. So she has a disc bulge, and it's causing a pinch on the nerve, which is causing her sciatic symptoms. So she had a disc fusion. Why does she still have sciatica? You know, like it should have gone away, right? So does anyone have an idea of what it could be? Like why? How do I look at it again? Oh, okay, yeah.
Yeah, give it a second because there's
Should I
like
just wait? Okay, yeah.
there's a lag. So they're gonna get your question a little bit later than we do.
So you know how like you're putting on like a lot of questions. Are these separate people, or are all these? Is that like
They're all
one?
separate people.
Oh, okay.
But yeah, so these questions are all like the ones that are popping up in the YouTube live chat. So I'm just copying and pasting them so you don't have to go
Oh, okay. Okay. Yeah, I'll probably answer those
towards
after.
the end. Yeah. Someone said muscle inflammation.
Yeah, that could totally be it for sure. So key thing, it can be anything that's causing irritation of the sciatic nerve. You know, it doesn't have to be the disc, but the big thing is the MRI showed that she has a disc bulge in her low back, and it's pinching on the nerve right there. Okay, I'm gonna move on. Which one am I at? Okay, so here's a research study. 37% of 20-year-old individuals have asymptomatic disc degeneration. So a disc bulge is prevalent in 30% of those 20-year-olds. So the MRI showed that she had a disc bulge, but that disc bulge wasn't causing any issues. But she still had to go get surgery. So they misdiagnosed her. She got surgery for no reason. That disc herniation probably wasn't causing any of her symptoms. Isn't that crazy? So I see this all the time. People will have like a little bit of like low back pain. They'll be like, oh yeah, I got an MRI and it shows that I have like 3 disc herniations. And I'm like, so what? I have 2 in my low back and I don't have any pain, So I'll get to that. I'll get to my point. So I treated her for piriformis syndrome. I can't believe someone said muscle inflammation. So this is more of this is less inflammation of the muscle. This is more spasticity of the muscle. So this piriformis muscle is too tense, too spastic. It's different than inflammation. You treat it differently. So basically I treated it for piriformis syndrome, 80% better after 1 treatment. And I just wanted to use this case to let people know, like, an MRI is just a snapshot of what's going on. There's so many people that have so many crazy issues. They get all this imaging done and they can't find anything. Like, people will have the craziest low back pain. They can't even walk. They're like, yeah, but I got an MRI, I got an X-ray, I got a CT, and they didn't find anything. So, like, is it all in my head? And I'm like, no, it's not all in your head. It's just something that the MRI can't find. Like, it's something else. Something else is there. And it doesn't matter what it is. Like, let's try to fix you, So don't get in the radiology mindset of, oh, yeah, there it is. He needs surgery because he has a disc bulge. Because you can take an MRI on every single person in the world. 30% of them that are above the age of 20 will have a disc bulge, and like a lot of them aren't symptomatic. So just keep that in mind. when you hear disc herniation, it doesn't always mean that it's the worst thing in the world. There are amazing physical therapy exercises that you can do to kind of combat your herniation. Here's another one. So we got 27-year-old male. He has left-sided shoulder blade pain and numbness for about a year. I know this is the right side, okay? It's not the left side. I couldn't find one with the left side. So this guy has been to multiple chiropractors, physical therapy, acupuncture, massage, MDs. Nothing has helped. He still has numbness in here. He still has pain. He doesn't know what to do. He's like, dude, help me, please. I've seen your videos. I want you to fix me. So I was like, oh, like, what did the chiropractors say? You know, like, what did they do? And he was like, oh yeah, the chiropractors just said that it was my ribs. Like, I just had like ribs that were out of place. So they would just pop the ribs back in and it would feel good for a little bit and then it would come back. Physical therapist, oh, well, if chiropractic didn't work, what did the physical therapist say? And he said that it's because my shoulder blade isn't stable. I need to stabilize it by strengthening the muscles around here. Did it for 3 months, didn't work. So, any ideas? Let's see, people. Let's see. This is a good one. If someone gets this, I'll be so impressed. Is there anything?
Give it a minute. There's like a lag, so it'll.
Oh, there is? Oh.
Yeah, it'll take them like a second to hear your question.
Yeah. I'm antsy, dude. I'm antsy. I want to know. I want to know. Oops. I forgot people could see my screen.
Yeah. Nothing yet. Maybe people just don't know. Oh,
Yeah,
interrupted
okay.
blood circulation.
Oh, blood circulation. That's cool. Nah, probably not. Yeah, so blood would cause throbbing pain. That's usually like muscular related. So this is oh, I didn't say, but yeah, it's sharp pain and numbness. So when you think sharp pain and numbness, you think nerve. Every single time. That's nerve related. Throbbing, like dull, achy stuff, that's usually muscle. But sharp and numbness, that's nerve. So the reason why the chiropractors, the physical therapists couldn't help this guy is because the problem was coming from his neck. So I wish I had, hopefully everyone knows what, like, no, they probably don't know what C5, C6. So if you look at this, think of this as in your neck, right? So let's say these are the cervical vertebrae. So the C area. So C4, C5, C6. So in between them, we have these nerves that come out, just like sciatica. So if you piss one of these nerves off, you'll feel it go down your leg. It just so happens that those nerves in your neck, if you piss them off, they go in this trajectory. But it's not always in a straight line. Sometimes you just feel it like right here, right in the shoulder blade area. So his problem was coming from C7 and C8, which is the nerves that come out of his lower neck. So all he had was a little bit of compression in his lower neck. And I did my normal treatment and boom, it was pretty much gone. I followed up with him like a week after. He had full range of motion in his neck. He had no pain. He had a little bit of numbness in his shoulder blade, but you know, he literally thought I was God. He was like, dude, I've been dealing with this for years. I have spent so much money. I've done all these things, and this is all I had to do. So this is something that I see on a daily basis. Anyone that has shoulder blade pain, I'll ask them like, oh, like, have you been to a chiropractor before? They're like, I've been to like many chiropractors and they just say it's my ribs. So just keep that in mind. Radiating pain is a huge thing that I see all the time. Any type of shoulder blade pain, any type of shoulder pain, any pain in your traps or any tingling in your fingers, carpal tunnel, it's probably coming from your neck. Any type of pain in your butt, any type of pain in your hamstrings, your calf, probably coming from your low back. Sometimes it's not, most of the time it's not, but when people come to see me, it is, because a lot of people missed it. Okay. I'm going to show a video of a decompression adjustment that I do. I don't know if anyone knows what this is, but I'm going to show it. Put your hands on your stomach for me.
Holy moly.
So like right there, I basically, I put the strap around her head and I pull up on her head, and basically that lower neck and upper back area just decompresses, and it opens up that area. It takes pressure off of the nerve, and it allows that nerve to pretty much breathe, and it really likes that. And boom, all the pain's gone. And yeah, that's it. So my journey, this is my dad, this is my mom, this is me when I graduated. Schooling, I went to UC Riverside for 4 years. I got a BS in neuroscience, and then I just jumped right into chiro school. I graduated summa cum laude, which I think is good. I don't know. It's like the higher one, I guess. But I busted my ass off, and I did really well in school. And, you know, there's a lot of chiropractors that aren't very skilled in adjusting. When I first started, I wasn't that good. But I was very insecure about my skills. I wanted to be the best. And, you know, there was a couple times where I was kind of put on the spot, and, you know, I had the class watching me, and I bitched out, you know, I didn't do it right or something like that. I got nervous. But, you know, I was that guy that would go home and not sleep the whole night and watch YouTube videos and close my eyes and like imagine the patient in my hands, and then do it again over and over and over. Grab all my friends at school, adjust them all the time. We used to adjust each other like 5 or 6 times a day. It was horrible for our bodies. So bad for you. But, you know, we didn't hurt each other or anything. But I busted my ass off to get to where I am. And I feel like I'm really good. And I have a lot of confidence now. So just goes to show, like, when you're in school, you don't know shit. Just keep working at it, and you'll become good. Any advice? So I just want to talk about loans. So just remember that grad school is expensive, and you always have to pay the money back if you take loans. You don't just get free money. If your parents are paying for it, you need to cherish it, and you need to thank them forever, because when you're done with school, you will have a huge head start over everyone. There's something called a grad plus loan. So basically, you get a loan for tuition. That's like your normal graduate loan. If you get a grad plus loan, that is spending money. That they give you a lot of money. So be careful with the grad plus loans, because I graduated and I have probably 3 times less loans than my colleagues, because they took those grad plus loans and they partied, they lived on their own, they traveled, they did all the kind of stuff that they wanted to do. And if you're like $300,000 in debt when you're out of school, it's going to be really hard to start your own business, because you won't be able to get a business loan, because they'll look at that and they'll be like, how are you going to pay our loan back? You already have this much to pay. So just be careful with that. Purpose. Yeah. So, you know, going into my field, it's very lucrative. You can make a lot of money. And, you know, if you're in it for the money, God bless you, man. Cause like you can make a lot of money, but I hope you're not just in it for the money, because that's what those are the type of chiropractors that give us a bad name. Those are the people that try to get people to come back all the time. I'm in a like a crazy different. I have a crazy different philosophy. I'll get to that because I think I saw a couple of questions, but I'll get to that later. But just have a good purpose, man. Just try to like actually help people. This is specifically for chiropractic. I know the medical field's a little different, but there are chiropractors that go into it strictly for money, and it's kind of sad. So another thing I want to talk about is ability. I'm a tall guy. I'm 6 foot. I'm kind of tall, I guess. I've been working out my whole life. I've been in sports my whole life. I have big hands. I can adjust people. I see a lot of younger or less big, maybe females, maybe like 5 foot tall, maybe like 95 pounds, who want to go into chiropractic. And it's so big at my school to see that, and they can't adjust. And nobody tells them, hey, this is going to be very hard for you because you are not a big person. This is like, say you're a 5 foot, 100-pound female chiropractor, and you have a 6'5", 300-pound man come in, and he says, hey, I have back pain, fix me. What are you going to do? What are you going to do? You're gonna like lie to him and say, like, yeah, I can do it. No, you won't be able to. It's very hard. And there are a lot of females who make it work, and they're amazing. There's other areas of chiropractic you can go to. You can go into nutrition. You can go into post pregnancy. You can go into babies. A lot of people adjust babies. I personally don't. But just remember, if you want to go into pain management like me, I'm working on big boys all the time. My body hurts. Like sometimes I'll see like 16 people in one day, and I spend 30 minutes with every single person. That's 8 hours. And yes, it's mentally draining, but physically draining. Sometimes I can't even move my hands at the end of the day. I'm so dead. And I'm pretty good with my technique. So yeah, I don't know where I'm trying to go with that, but just remember, it's a very manual labor-ish job if you want to do it right. So you have to devote yourself. Why I'm different and proud. So I already had a slide for this. So yeah, it hurts. My job hurts. I get adjusted like once a month. I get a massage like twice a month, and I try to work out like 3 or 4 times a day. I eat as healthy as I can. I get ample amounts of sleep, and it still hurts. But I got to take care of my body for my patients. And I spend 30 minutes with people. I put my hands on you for about 30 minutes. I do a lot of massage. I do a lot of rehab therapy and a lot of education, as well as the chiropractic stuff. I just really want to be a one-stop shop. I want people to come in and just need to get treated. And I want them to walk out feeling amazing. And I want to be able to say, I'll tell you when to come back. I'll tell you if you're allowed to come back. That's where I'm at right now. And there's a huge stigma of chiropractors who say, like, they sign you up for this long-term treatment plan. You got to go 3 times a week for like 6 weeks, and then like 2 times a week for like 6 more weeks after that. I want to be different. And yeah, some of my patients don't come back for a year, but I'm totally okay with that because I'm not scamming anyone. I've told so many people this same exact thing. I know you feel better right now, but in 2 or 3 days, I'm going to reach out to you and I'm going to check in and see how you're doing. If you feel exactly the same as how you came in to see me today, then I can't help you. My treatment isn't going to be able to help you. And like that is boom, right there, trust. You build a brand of trust. So chiropractors in themselves, the stigma of us is we are untrustworthy. And that's fine. I'm okay with that. There's, people in our profession have screwed it up for everyone else. But I want to be the trustworthy guy, and people really appreciate that. I have all 5-star reviews. People send their children to me, their grandmas, their grandpas, and it's beautiful. So, yeah, I'm just gonna keep rambling. So I guess I'll just like open it up. Here are my handles. I have TikTok, Instagram, and I just started YouTube. TikTok, I'm like it's like more of like my like funny side. IG is more of like the real side, and then YouTube is going to be like a little bit longer videos so you can really see what I do. Okay, how do I go to the chat thing? Here we go. Should I not share while I
yeah, you don't have to share your screen anymore. I can just post your Instagram handle in the chat for them if like anyone wants to look at it, and you can just go through the questions now.
What do I do here? Oh, just stop sharing, right?
Yep.
Yeah, there. Okay, cool. Okay. One of the questions, how does a chiropractor help sciatica? So like we talked about, it depends on what is causing the sciatica. Sciatica isn't caused by just one thing. There's many things that can cause sciatica. So, if the sciatica is caused by a joint dysfunction, the chiropractor can adjust that joint and take away the inflammation in that joint, which is pissing the sciatic nerve off. We can do decompression therapy, which if it is due to a disc herniation, we can decompress that disc and take the pressure off of the nerve, and it'll make the sciatica better. There's a lot of things. That's a hard question to ask or to answer. Is chiropractic treatment appropriate for children? Okay, so there's a lot of different theories on how chiropractic works. I personally don't believe any of them, but a lot of people do, and a lot of people stand by how they think. A lot of chiropractors think that specific segments in your spine correlate with specific nerves. So basically, if you adjust a certain area, it turns that nerve on and it makes that area work better. It makes your immune system better. I don't believe any of that stuff because it's hard to prove, whatever. All I do is I'm a tension-based chiropractor. I go through the spine and I find the tension, I find the kinks, I find the knots, I find the areas that are stuck, and I get rid of them. Children don't have any tension. Like, they're little wobbly little human beings, So my philosophy does not correlate with children, does not they don't have any tension, so I don't need to treat them. So that's why I don't advertise that I treat children, but some people do. And just because I don't believe in it doesn't mean it doesn't work. They help a lot of people. They help a lot of children. So find a chiropractor who specializes in children, who does believe in that, and go to them. I just don't advertise it because I don't believe in it. And if I don't believe in something, I can't sell it. Was there someone who introduced you to chiropractic medicine? Don't say chiropractic medicine. Chiropractic is not medicine. I don't know why chiropractors call themselves chiropractic physicians. No, we are chiropractors. I don't like it when people call me a doctor. I have a doctorate degree in a field that I love. That's all I got. You can refer to me as Dr. Tyler, but I don't like it when people call me, oh, he's a doctor. I don't like that. That's just me. Dentists are doctors. Lawyers are doctors too. They have a JD degree. You don't call your lawyer a doctor. So why are you calling me doctor? Okay. So chiropractic medicine, take the medicine out. Yes, I had a chiropractor growing up. He was amazing. I idolized him, and he was one of the biggest reasons why I joined the field. Is chiropractic treatment ongoing? Again, it depends on what that chiropractor believes, and it depends on what you want. Um, a lot of times, it's not a one-stop shop. A lot of times, I can treat you, and hopefully you'll be good for like 2 or 3 months. But if your pain is due to you having horrible posture while you sit, it's going to come back because you're just going to go back and you're going to sit for 8 hours a day. And then you're going to sit down and watch TV. And then you're going to go to sleep and be in a little fetal position with like 20 pillows like this, like screwing up your neck. And you're going to be eating like shit and sleeping like shit. It's going to come back. That's what you use me for. So if it depends on what you want. Are you that type of person that just thinks that you can go into something and get it fixed forever? Then it's probably not going to work for you. Okay. What is the most common misconception people have about what you do? What do you like about what you do? Most common misconception is that we are all the same and we are just in it for the money and we just want to make people come back and that we think we're doctors. But I'm trying to change those misconceptions, and I think I already kind of answered those things. My first question is, what is the most challenging part to be a chiropractic doctor? What is the most challenging part to be a chiropractor? Let's just say that. So you are the front line of what can be major conditions. I think, I don't know if you saw in the beginning, but you can have right-sided like shoulder blade pain, and that could be a gallbladder dysfunction. There's referred pain from your gallbladder in that area. You can have low back pain, and it could be cancer. So, and a lot of times people just don't go to their doctors. There's stubborn men who, you know, they got low back pain. They just deal with it. They don't want to go to the doctor. They don't want to do blood work. They're like, no, I'm good. I don't need medication. I'm good. So that's one of the most challenging things. If someone has an aneurysm in their neck, they have an aneurysm, which is kind of like a buildup of blood from a clot. If they have an aneurysm in your neck and you try to adjust their neck, boom, you can slit their neck. You can slit their vertebral artery, and they can bleed out and they can die. It's not easy to figure out if someone has an aneurysm, but there are signs and symptoms that they will show up with. And if you don't ask them the questions to find out, you're in trouble, buddy. You're in trouble, and you ruin it for every chiropractor because it doesn't happen a lot. But when it does happen, when a chiropractor does crack someone's neck and they stroke out and they die, it goes viral, and everyone thinks it happens all the time. Yeah, it's mostly just defending my profession. That's one of the most challenging things because there's a lot of bad chiropractors out there, and it ruins it for everyone. Second question is, do you work with physicians and other specialties? Yeah, of course. I refer a lot of my patients. I don't have specific physicians that I send my patients to, but I'm the guy who convinces people to go see their primaries and to go get blood work done. And yes, I always refer. I have a lot of people that I'll literally just look at them. I'll be like, yeah, you need surgery. So, I'll send them to orthos. I'll literally tell people, I can't treat you until I see what this looks like. So you need to get an MRI or you need to get an X-ray, blah, blah, blah. So yes, I work with a lot of other specialties. Like I said, there's a physical therapist in my office. We work, hand in hand. Physical therapy is awesome. I have an acupuncturist right next door, and I send her people. Like I'm all about trying everything. Whatever you need. What type of education do chiropractors get? I already said that. It's about 4 years of a doctorate program. Why'd you choose to be a chiropractor? So when I was a kid, I could feel things with my hands. Okay. My mom would always be like, "Oh, Tyler, give me a massage." And sometimes I could feel with my hands when she was stressed. I could feel it. Like I could close my eyes and I could feel the stress in my body. So I knew at an early age I could feel things with my hands, and I started going to a chiropractor, and I really liked it, and it was always on my mind. And when I went to college, I was like, I studied the brain, I studied the nervous system, and it just kind of made sense. After when I was finishing college, I was like, okay, that's what I'm gonna do. And because I chose it, boom, I'm gonna be the best. I'm gonna try to be the best. How do you think the future for chiropractic medicine will look like? Yeah, I don't really know what that means, so I'm not going to answer that. What has been your most challenging case, and how did you handle it? Yeah, it's hard to. I already kind of answered that. Would you recommend getting experience as a licensed chiropractic assistant? Yeah, that'd be cool. They might actually just use you, like doing like vibration therapy stuff. But it would be cool to just like see the flow and kind of get a feel for things. But you could always just hit up a chiropractor and ask them if you can just follow them for like a couple hours. They would be more than happy to do that. What are your opinions on the ring dinger and the Y strap? So the Y strap is a big part of my practice. I do not do it on everyone, but like I said, a lot of people that come in to see me have already tried multiple other chiropractors, multiple other physical therapists. They've been to their doctor, they've gone all these imaging, and nothing's helped. So I look at it at a deeper level, and a lot of times it is compression related. They have compression in their spine, and they need to be decompressed. So those people need the Y strap. And when they get the Y strap, boom, I'm literally God. They call me God. They're like, oh my God, like, you're amazing. And they send me all their family. So it looks scary. The Y strap looks scary. I think I showed a video of it. It looks scary, but it is amazing. What is your most favorite part of the spine? Most favorite part of the spine would definitely have to be the neck. All your nerves come from there. Everything stems from the brain. You got major arteries in there. The neck is just so sensitive. I love everything about it. I love treating headaches because they're so complex. A lot of times your headaches are coming from the top of your neck. So just keep that in mind. Why did you become a chiropractor? How would you know the right questions to ask? That's probably from one of the cases, but knowing the right question to ask, that's what you learn in school. And a lot of people are screwing around in class when we're learning that stuff, but that's the stuff that saves lives, and that's the stuff that makes you really good at what you do. How do you diagnose a patient who has back pain? What is the hardest part about being a chiropractor? Do they have to be on call ever? No, we're not on call. I own my own business. People schedule online, and I have available hours, so I don't work after a certain hour. What is the difference between chiropractor, podiatry, and physical therapy? Also, why did you choose becoming a chiropractor versus MD-DO, even though they are both 4-year programs? So I have never taken antibiotics in my life. I grew up just never taking any type of medication. Like, just medicine is not for me. And I understand how important it is. It is amazing. Like, my uncle and my aunt are both in the field, dermatology and general practice, but it just wasn't for me. That's just how it was. I like to use my hands. I like to solve puzzles. And yeah, that's kind of it, chiropractor and podiatry. Podiatry is feet. So, they're working on people who have foot problems. Physical therapy is, physical therapy is there's a lot of different types of physical therapists. If you're referring to an orthopedic physical therapist, they do a lot of rehab therapy and exercise therapy with athletes and, sports injuries and stuff. Do you recommend alternative medicine to your patients, such as acupuncture, traditional Chinese medicine? Yes, all the time. Homeopathy, not so much. I don't really like homeopathy too much. It's kind of weird for me, too weird for me. Doesn't mean it doesn't work, Doesn't mean it doesn't help a lot of people. It's just weird for me. So I can't tell people to go to someone if I think it's weird. What is the difference between physical therapy and chiropractic medicine? Are they similar? Yeah, they're similar. Don't say medicine. If you didn't choose chiro, what other healthcare profession would you consider? I don't think I would consider healthcare. I think I would go into engineering or business. In regard to your education, what would you have done if you could do anything different? Education. I mean, that's hard. That's hard. Maybe have better relationships with my professors because you guys don't know me at all, but I was the guy in class who would challenge every professor, and I'd always just be like, why? But why? But why? So people didn't really like me too much. But it is good to have relationships with your professors, especially in school. And it just like makes the school a little bit better. I don't know. That's a hard question, man. What would you have done if you what would you have done if you could do anything different? What's the most memorable case or patient you've had? Yeah, I mean, it's just those cancer patients, the people that come in and they have like, oh yeah, man, my neck hurts, my low back hurts, and you figure out that it's probably something serious, and you convince them to go get it looked at because they don't want to. You have to have the conversation like, listen to me right now. I do this every day. I know when something is fishy. You need to go get this checked out, or else like I'm gonna like freaking slap you or something. You have to convince them somehow. And then they have cancer, and then they call you, and that conversation is really sad. Like they're crying. They're like, hey man, like thank you so much. Like you're awesome. That stuff's cool. How has the pandemic affected your job? Oh, great question. So actually, it boomed my job. So I do a lot of social media marketing. I do a lot of video marketing. And during the pandemic, what were people doing? They were sitting at home all day. They didn't have jobs. They were getting paid more money by the government, unemployment, and they were looking at TikTok and Instagram videos. So they had a lot more time. They had a lot more money, and they had a lot more pain because they're sitting down a lot. So more people came in. It was cool. It was awesome. Very blessed to be able to say that because not a lot of people can say the same thing about the pandemic. What would you have gone into if it wasn't chiro? I've always been a physics and math nerd, so like definitely engineering. And I'm good with people, so like owning businesses is something that's in the horizon for sure. I think that's the last one. My brain hurts, dude. I feel like I just talked for so long.
Yeah, but everything you said was super interesting. Love the cases. Everything was super interesting. The presentation was actually really good.
Oh, really? Aw, thanks.
Yeah, so thank you so much for speaking for us today. We definitely learned a lot. But yeah, so thanks for being here with us.
No problem. You guys are awesome. Keep it up. Like this is so cool. You guys are 18 years old and you guys are doing this. Like so cool. Just keep it up. Keep going.
Thank you. Thank you.
You're awesome. Bye,
and
everyone.
One more thing. For everyone else still watching, just make sure to fill out the Google Forms that we posted in the chat. And yeah. So thank you so much.